There's two pathogens that kind of eat away at your bones. This is probably scary reading for bedtime. Our first one is called strep. Our second one, I can't pronounce that. Strep grows in long purple chains, purple meaning gram-positive. As a matter of fact, this guy here is also purple, saying it's also gram-positive. Also, as a matter of fact, the two bacteria that cause osteomyelitis, that is the Staph aureus, can't remember it, Staph epidermidis as well, they're also gram-positive. So don't ask me why, but bone diseases tend to be gram-positive bacteria, general rule of thumb. I remember pyogenes is a good, well, we can change with this good technique. My favourite fruit is pie. If I have lots of pies, that's a chain of pies. Chain of pies, chain of pyogenes. Pyogenes grows in low oxygen or no oxygen environments. Low oxygen is called facultative anaerobe, and no oxygen is called strict anaerobe. The infection spreads rapidly and penetrates tissue, activating a large broad-scale response. This large broad-scale response causes your immune system to go absolutely crazy. Therefore, it's not really able to specifically target this bacteria. There's a couple of virulence factors that you should know about. The most important is M protein, which works against complement. We've also got super antigens. These recruit a lot of T cells at once. Normally, in an infection, we get something called monoclonal activation. This is when one T cell clones and clones and clones. In super antigens, we get all types of T cells being activated. It's simply too much for your immune system to handle, and the immune system goes crazy. Instead, polyclonal activation, we get a big cytokine storm, lots of inflammation. We also get hemolysins, which break down blood. We also get liptic acid and adhesin, which sticks to cells, and C5a proteases, which break down complement. These all lead to the common symptom of necrotizing fasciitis. This is a type of gangrene, which is due to perforating arteries that penetrate the tissue. The patient will present with acute pain and will be in a toxic state, meaning where they'll have a fever and will be full of toxins. This erythema, this redness, spreads rapidly and is also very painful. This necrotizing fasciitis, in rare circumstances, can also be caused by E. coli. We whack it with intramuscular benzoyl penicillin, the cousin of the birth of mold penicillin, and also we can give it clindamycin, an antibiotic which acts on ribosomes to prevent toxin production. If it's really bad, we might have to cut it away with surgical debridement. On to our next pathogen. I can't pronounce it, but it grows in purple rods. I think it's pronounced Clostridium. This produces a nasty gas that starves the tissue of blood supply. Because we're starving the tissue of blood supply, we can actually get less T and B cells there, leading to less inflammation. There are a few virulence factors. 17 exotoxins, of one that you should know is toxin A, which causes cell lysis. And these different toxins ferment carbohydrates, meaning breaking down cells. As I mentioned, this bacteria produces a nasty gas which makes your leg very puffy. This can cause gas gangrene. Gas gangrene leads to these dark red blisters called bullae. These spread around and can also be very painful. This redness, erythema, can spread, and the patient is also toxic in this case as well. However, contrasted to this widespread inflammation, we get very little inflammation in this one here, Clostridium. We whack it with benzoyl penicillin, BP again, not the petrol company BP, and if it's bad again, we can cut it away with a surgical debridement or amputation. Hopefully this hasn't scared you too much. You will be able to recall the differences between these two, and I wish you the best of luck.